It's Wednesday, November 6th, and this is the Daily Medical News, where we bring you the top headlines in clinical medicine, plus a closer look at the day's biggest story. I'm Nick Andrews.
And I'm Molly Collegio. Today, signs of adult type 2 diabetes may reveal themselves in childhood.
Body weight can influence SGLT2 inhibitors' effect on type 1 diabetes.
An oncologist is nominated to head the FDA.
And how a childhood measles infection can dull the immune system for years later.
Plus, CMS is bringing more pay for E&M services and more change to the merit-based incentive payment system. But first, we want to thank all of you who've helped us make this podcast better by completing our short listener survey. If you haven't already, please take the survey by following the link in the show notes. And now, the news.
Abnormal HDL cholesterol metabolism in children could be a red flag for type 2 diabetes risk later as adults. Researchers at the University of Bristol in England found changes in HDL cholesterol metabolism in children as young as 8 years, decades before the disease's clinical onset. They reported the findings at the annual meeting of the European Association for the Study of Diabetes. The investigators linked genetic risk with metabolomic data collected at 4 time points from more than 4,700 children in a longitudinal parent-child study. One early metabolic feature that stood out was the size of the lipid particles at age 8. Among those who would go on to develop type 2 diabetes, there were reductions in the lipid content of HDL cholesterol particle subtypes. By age 16, strong associations remained between lower lipids in HDL cholesterol particle subtypes and type 2 diabetes risk. The researchers say that knowing the early features of type 2 diabetes could help clinicians intervene much sooner to stop progression to the disease.
For patients with type 1 diabetes and a high body mass index, adding an SGLT2 inhibitor to insulin therapy delivers the most benefit with the least risk. That's the key finding from a study presented at the annual meeting of the European Association for the Study of Diabetes. Researchers at Hanover Medical School in Germany analyzed data from the INTANDEM 1 and INTANDEM 2 trials. They looked at the outcomes of patients with type 1 diabetes treated with insulin, plus either the SGLT2 inhibitor sotagliflozin or placebo. They found greater hemoglobin A1c reductions with sotagliflozin than with placebo. And the effect was even greater among patients with a BMI of 27 kilograms per meter squared or greater. Sotagliflozin treatment was also linked with an increased time in range compared with placebo. Again, the greater effects were seen in the higher versus lower BMI groups. The risk of diabetic ketoacidosis was higher than placebo in both BMI groups. But the number of such events was very small when comparing low and high body weight categories.
Radiation oncologist and researcher Dr. Stephen Hahn may soon take the reins of the FDA. In a brief statement, President Donald Trump said he'll nominate Dr. Hahn as FDA Commissioner. Dr. Hahn currently serves as the Chief Medical Executive at MD Anderson Cancer Center in Houston, where he heads the Radiology Oncology Division. The American Society of Clinical Oncology congratulated Dr. Hahn on the upcoming nomination. The society noted that he has a strong grasp of the drug development process and he understands the realities of working in a complex clinical care environment. Current acting FDA Commissioner Dr. Norman Sharpless will return to his position as director of the National Cancer Institute. He served as interim commissioner after the April departure of then FDA Commissioner Dr. Scott Gottlieb. The Daily Medical News will be right back after this.
A new study may explain why childhood mortality and secondary infections rise several years after a measles infection. Researchers at Wellcome Sanger Institute in Cambridge, England, analyzed genetic changes in 26 unvaccinated Dutch children who previously had measles. They also looked at 2 control groups of vaccinated adults and unvaccinated children from the same community who weren't infected with measles. The researchers found that naive B cells from those in the vaccinated and uninfected control groups showed no significant differences in gene expression over time. In measles patients, however, the post-infection naive B-cell population showed genetic changes that limited their ability to respond to new antigens. And measles infection may also induce immune amnesia by harming the immune system's memory of previously encountered antigens. Uninfected and vaccinated controls exhibited a stable genetic composition of B memory cells. But post-measles B memory cells showed significant increases in mutations. The findings appear in the journal Science Immunotherapy.
And finally today, Medicare's 2020 physician fee schedule brings doctors more money for evaluation and management services. And it features an overhaul of the merit-based incentive payment system. The E&M changes will have a more immediate impact on doctors' bottom lines than the MIPS renovations. New E&M codes will allow clinicians to choose the appropriate level of coding based on either the medical decision-making or time spent with the patient. And 2021 will bring an add-on code for prolonged services times when clinicians spend more time treating complex patients. Beginning in 2020, clinicians will be paid for care management services for patients with one serious, high-risk condition. Previously, a patient would need at least 2 serious and high-risk conditions for clinicians to get paid for care management services. For those with multiple chronic conditions, a Medicare-specific code has been added that covers patient visits that last beyond 20 minutes allowed in the current coding for chronic care management services. Under the current MIPS structure, clinicians report on a specific number of measures chosen from a menu that may or may not be relevant to the care of patients with a specific disease, such as diabetes. To reform MIPS, CMS will roll out a new MIPS Value Pathways Framework, or MVPs. CMS says the new framework will have measures aimed at population health and public health priorities. The agency also says the reworked approach will reduce the MIPS program's reporting burden and give clinicians better data and better feedback. The MVPs framework will have foundation measures in the first 2 years linked to promoting interoperability, and all clinicians will use those measures. Over the next 3 to 5 years, disease-specific measures will be refined and foundation measures expanded. CMS says those disease-specific measures plus the foundation measures will still add up to fewer measures than clinicians currently report. For a complete rundown of all the changes, click the link in the podcast notes. And that's it for today's Daily Medical News. Be sure to catch the newest episode of the Psychcast by MD Edge, available today and every Wednesday. For MD Edge, I'm Nick Andrews.
And I'm Molly Collegio. Thanks for listening.